All right, let me pull this up and we'll get started. Thank you everyone for your patience today. All right, can we see this full screen?
Yes.
All right, thank you so much. Yvette, take it away.
Okay. Good afternoon, everyone. Thank you for having me today. I wanted to discuss a little about congenital syphilis in Broward County. I'm the perinatal director for the Florida Department of Health in Broward. We deal with women that are positive for syphilis and women that are HIV positive. We ensure that they get treatment and that they're in care. Next. So why am I here today and what's going on in Broward? There's been such a sharp increase in the number of babies born with syphilis in the United States. Somebody needs to mute themselves, please. Thank you. The congenital syphilis is a disease that occurs when a mother that has syphilis passes the infections onto her baby during pregnancy. It can cause very serious health problems, including stillbirth. Pregnant women can protect their baby from congenital syphilis by getting tested for syphilis during pregnancy at the beginning in their first and their third trimester and getting treatment immediately. They need to be treated at least 31 days prior to delivery. Next. So I would like to give you just a little bit of statistics. Congenital syphilis cases in the United States have more than tripled in the recent years, with more than 2,000 cases that were reported in 2021 alone. This is the highest number that has been reported since 1994. And how congenital syphilis affects a baby's health depends on how long the mother has syphilis during pregnancy and if she got treatment prior to delivery. And one thing I do want to tell you that sometimes the numbers go up and they go down, but it's always a wave. And right now, it's not only here in Broward, but it's everywhere in the United States that the congenital syphilis cases are really growing. Next. So the Broward numbers, in 2018, we had 5 cases for the whole year, which was great. That's one of the lowest that we've ever had. And then as you can see in 2019, it started to rise. In 2020, 2021, it went down a little bit, but then look what happened last year. We had 30 cases of congenital syphilis. And right now in 2023, we're holding on to 12. And the reason I say that is because we have to wait till the end of the year to actually get a good number. We also watch these cases from the beginning and until the end. We do chart reviews. We do chart reviews at birth. We do chart reviews at their OBGYN if they have any. But some of these cases have no prenatal care. So there's very little information to get until we get it at delivery. Next. So what is syphilis? Syphilis is a bacterial infection that usually is spread by sexual contact. But the problem is that it starts as painless as a sore. It starts as a sore, but it's painless sore. So women hardly even notice it unless they are paying attention to their bodies. In a male, you can't see it because it's outside of the penis, but in a woman, it's inside, and it doesn't hurt. So she might never even know that she has it until she gets tested. And it also develops in stages. Symptoms vary with every single stage. You have sores in the genitals, in the rectum, in the mouth, between 30 to 90 days after you have exposure. Sometimes they last very few days, sometimes they don't, but the majority of them last very little. There's a body rash that possibly after the symptoms of the illness, you get between 4 to 10 weeks after infection. It happens in the hands, it happens in the feet. And then you'll have something more internally. So there is syphilis in the brain and the eyes and the heart. And sometimes if you don't get treated, you could have this for over 15 years until something really terrible happens where I can talk to you about a case where this man was over 65. They never asked this gentleman if he was exposed to syphilis or had unprotected sex at that age until he got to Sylvester Eye Hospital, where he had to go because he was losing his sight. When the eye doctor asked him if he was having unprotected sex, and he said, yes, as a matter of fact, a couple of months ago, I was having unprotected sex. And he says, has anybody treated you or tested you for syphilis? And he said, no. And what he had was syphilis in the eyes. And all he had to do is get treated, possibly with long-term penicillin, a lot more than maybe 3 shots. But he was treated and his eyesight came back. But things like that happen all the time, because syphilis is really, it's masked into like another disease sometimes. And if you're not an infection control person or an infectious disease physician, it might be masked by something else. Next slide, please. So it occurs in pregnant women and they pass it on to the baby through the placenta. It's increasing so much in the United States that now every single, I would say every place that has a very large number of STDs and STIs are putting this out there everywhere. And it's preventable. There's women that get 1 shot and that's all they need. And then depending on what stage the syphilis is or how long they've been infected, they might get then 3 shots. And then this is what happens. They have to get these shots 7 to 10 days apart. No more than that, no less than that. If they get it less than 7 to 10 days, it's like you haven't gotten shot with it. If they do it more than 10 days, you're going to have to repeat it again. So think about, we have women that sometimes get picked 3, 5 times. Why? Because they missed the time frame and they have to be done again. And it's painful to get picked sometimes. And sometimes they don't want to do it. So we're always on top of them and ensuring that the time frame that they're getting these treatment is exactly what they need to do, or else it's a case where she wasn't treated adequately. Next one, next slide. So this is everything that the syphilis can cause. It can cause miscarriages. It could cause stillbirths. It could cause prematurity in the babies, low birth weight. It can have one of these or all of these. It can have infant death shortly right after birth. And the cases of congenital syphilis have more than tripled in these recent years. Next slide. And this is some of the conditions in the infants. They can have deformed bones. That's why we have to have x-rays to look at their long bones. They can have severe anemia, so their blood count will be off. They can have an enlarged liver or a spleen. The babies could have jaundice, where they have yellowing of the skin or the eyes. It can even go to the brain and to the nerve. They can have meningitis and they can have skin rashes. Next slide.
Oh, dude.
And this is what it looks like. I know I have because that's
give us a warning before.
So this particular picture, right? Rhinitis with purulent nasal discharge. It is a very thick and opaque in color. And it can occur at any age, but usually it's treated if it's short term with antibiotics, like, for example, amoxicillin. And it also can, they also give the baby maybe a nasal decongestion sometimes, depending on it. Next slide. This is typical desquamating and maculopapular skin lesions that happen in the babies. And they're pale, blister-like lesions. Sometimes they're in the ears, in the nasal bridges, in the feet, in the palms. Because the body has such inflammation, it's reacting to the syphilis, and this is how it reacts. It can be treated. It's treated with sometimes Tylenol for the fever, topical steroids, and some antibiotics, depending on the baby. But it is treatable. But these are the type of pictures that I want the moms to see, because sometimes, since they don't have any sores and they don't have any pain, they need to see what happens to these babies. Besides all the things we have to do to the babies, we have to give the babies IV for 10 days in the NICU. We have to do the long bone x-rays. We have to do a lumbar puncture, and we might not feel it, but I'm sure that they feel it. So this is the kind of stuff that I would like you to show clients sometimes, because that's what we're starting to do. Because maybe if they see it on the babies, maybe they will get treated on time and treated adequately. Next slide. And I think it's my last slide. Okay, so what can you do for me, right? What we do is we encourage all pregnant women to ensure that they're tested for syphilis in the first and again in the third trimester, which is between 28 to 32 weeks. We really like them tested more closer to 30 weeks because we want them to make sure that they are treated closer to delivery. If she tests positive, encourage and support it to receive treatments exactly as recommended. 1 injection and then they retest, or maybe 3 injections which is every week for 3 times. They can't miss a dose because then it starts all over again. And then we need the partners to be treated to prevent reinfection close to delivery. We tell these women over and over that if their partners don't get treated, and if they have unprotected sex with a partner close to delivery, they're going to get syphilis again. And it's like we did nothing, because the baby's then going to go 10 days in NICU. The babies are going to be treated with IV penicillin. They're going to do all the tests on this baby again. So this is one part where we've had, like for last year, we had about 4 cases of women that got reinfected even after they did everything right. But they got reinfected because their partner wasn't tested. So some of the things that we're doing at the health department is that we have syphilis tests with us. We'll go to the home of the mom and get her tested, or maybe the partner tested. So we've had staff that are now able to draw bloods. Anything that we have to do to at least stop these cases of growing. Next slide. And if you have any questions, this is my email and this is my phone number. If you think that the woman has told you that they have syphilis, please call me and give me her name and her date of birth, and I can look her up and ensure that she's been treated and tested on our end. And we will go out and even go out to where mom lives and talk to them about this. That's how we want to ensure that these cases are treated adequately at birth. Does anybody have any questions, thoughts?
Before we move to questions, Yvette, I'm going to ask everybody to go ahead and put their name in the chat for attendance purposes. If you haven't done so already, or even if you have, I just want to make sure that it's actually recorded. I haven't looked at the chat because it's recording, but I see there's 38 messages, but we have about 60 participants on. So I just want to ask that everybody go ahead and please type their name and organization in the chat so it can be recorded for attendance. Is there anyone on right now who has any questions for Yvette? Feel free to unmute yourself and ask.
So I also wanted to let you know that, I mean, I know a lot of people know this, but maybe they're not aware. We don't have an STD clinic at the health department, but Broward Wellness is run by AIDS Health Foundation, but it's also, they collaborate with us and they do they test for STDs and they treat for free. So if you have clients that, I know that these pregnant women, possibly most of them will have insurance, either Medicaid or outside insurance, But when it comes to their partners, sometimes they don't get them treated or tested because the partners don't have health insurance. But if they go to Broward Wellness, it's free, and they will also treat them. And I wanted to give you that phone number for Broward Wellness, and I can also give you the address. But the phone number is 954-767-0273. They will see anyone that's over the age of 18, possibly 17, but maybe, I think it's over anybody over 18. And they do not charge for testing or treatment.
Yvette, can you put that information in the chat, please, just so we can record
I
that?
sure can. I sure can.
Thank you.
I'm going to put the address as well. It's 750 Southeast 3rd Avenue. On the first floor in Fort Lauderdale. (33316). That is a very good question. Is this only for Broward County residents? I don't believe. I think that they have seen people from Miami. But I can find out, and then I can have Alima send it out to all of you. Any other questions, thoughts? You can call me anytime if you need any information regarding this. If there's a woman that needs help, you can give her my phone number, and have her call me. I will talk to them. I guess, we need these cases to go down. I have to say that out of the 12 cases right now that we have, 4 women did not have prenatal care. So if they don't have any prenatal care, we don't know anything about them, in the sense of they probably didn't have any tests, anywhere except if they went into the ER or something like that. But most of the time, they don't have prenatal care, so we don't know about them until delivery. Out of all those 12 cases, we did have cases of women getting reinfected at delivery again. So, but out of all those 12, there's nothing, we did everything right, because in the sense of the ones that had no prenatal care, we didn't do anything about those, but the other 8, they were treated adequately, but then the babies sometimes have elevated protein or low white blood cells. And then they're part of a case because there's something wrong with the baby.
Yvette, can you retype the number? They say there's an extra digit on it. It says
okay.
767-02073.
954-767-0273.
Okay.
Yvette, I have a question. My name is Tawana. How often do the OB providers test the moms for any sexually transmitted disease?
So that's a great question. So ACOG, which is what they should be following, wants them to do the first time they come in, and then do it between 28 and 32 weeks. So it's usually the first trimester and the third trimester, or the second to third. The problem arises when they, OBs get paid in one lump sum, unless something else is happening. But it's like they get a lump sum for a C-section, and they get a lump sum for a vaginal delivery. So they want to make sure that they go to the laboratory on the same time. But if you put them, because at 28 weeks, they have to do also oh my God, what is it? When they drink that liquid, to make sure that there's
glucose.
Right. So they do it at 28 weeks, but it's better if it's done a little bit closer to 30 weeks, because at least it's closer to delivery, and we have a better, we ensure that maybe she didn't get reinfected and stuff like that. But most of them are doing it in the first and the third trimester. When I came here 10 years ago, we did have a few doctors that were not doing the third trimester. Like if the woman was negative in the first trimester, they felt that it wasn't really necessary to do it in the third trimester. We changed their attitudes because women have sex all during pregnancy up to the last day when they deliver, and they should really understand that. And you're not 24/7 with the partner you're with. So some of them might do it maybe an extra test if the woman comes with like itching or discharge or something. But remember, with syphilis, there's a sore that you will have inside the vagina that won't hurt you. So you're not going to feel it. You're not going to know about it unless the actual partner tells them. And what are the odds of the partner telling you, I got syphilis, go get tested? I rarely see that. So it would be better if they got tested 3 times, or at least closer to delivery, but they're not going to do that. That's why we encourage some women who, have had syphilis and their partners have had syphilis to try to get tested even one more time before delivery. But it has to be, 31 days prior to delivery, because then we can get them treated accurately. So great question.
Thank you.
You're welcome. Anybody else has any other questions? Well, just if you know at least about Broward Wellness Center, you will help us a lot because, you could always give that to them. And if they want to take their partners to get tested for free, and it is for free. The testing is free and the treatment is free. So there should be no reason for nobody to walk around with an STD without getting treated.
Yvette, do you have palm cards, anything with the wellness information on it? That way maybe they can go to OBs and give it to their partners. So that we can leave there.
We can get some from AHF because they're the ones that give them to us. Their palm card says get tested and chill, free STD checking, freestdcheck.org. That's where it's under. I can put that.
Those would be good to have. So maybe we can set up a time or when Tawana is by the health department to reach out to you to bring down some, because that way she can take them to the OB offices. A lot of times the partners go with their spouse, so they'll be able to get them there.
I'll get you some up, and then I'll call you and I'll bring them to you.
I have a quick question.
Okay.
If the woman has been tested, has the partner has to be tested at the same time?
Not necessarily, because usually what the OBs usually do is tell the woman she's positive for syphilis, you need to talk to your partner. The problem arises, they're afraid sometimes to tell their partners because the partner is going to take it the wrong way. Because we have had instances where women are positive and partners are negative. That's not a good thing. But the majority of these women, a lot of them might not like to tell their partners unless they're married, for a long, long time. And I mean, I've had some women that actually will say, yeah, I'm going to tell him because he needs to get treated. I don't want anything going on with this baby. But very few and far between tell me that. I wish they would. I wish they would, take control over that. And sometimes they can't, depending on the situation they are at home. It doesn't matter if they're tested at the same time, but at least close to her testing would be good to find out if he's the one that is positive or not, so she doesn't get reinfected. Because it also happens with chlamydia too and gonorrhea. You could get treated, but if the partner's not treated, you're going to get it again. So it happens with all STDs.
Hi, it's Tawana again. So if the mom has syphilis, she doesn't tell the partner, just like you say, it's like with chlamydia and gonorrhea, it's not like mandatory reporting where they have to disclose the name of the people that they're having sexual relations with.
Yes. Okay, Tawana, that is a great question, but I'll tell you what, every time we get someone and we try to get the names, they said they won't disclose the names. It goes both ways. With men don't want to disclose and women don't want to disclose. With the pregnant women, we push a little further because we tell them, look, you have to get treated, and if you have sex with the person you were with and they're not treated, you're going to get it again. And we try to really push it. And if it's a husband, if they're married, they might disclose. But if it's the father of the baby, they might disclose. But if it's not the father of the baby, it's harder. It is a little harder. Because we ask them that it's a state statute that you're supposed to disclose, but we can't make them. We can just ask.
Yeah, thank you.
You're welcome. Anybody else have any other questions? That's why sometimes the people don't like the health department to be involved with their life, because we don't come with some happy news. We always come up with some news. But the flip side to that is that, we try to get them in care and try to get them treated. And this is treatable. Like gonorrhea is treatable, syphilis is treatable, chlamydia definitely is treatable. The only one that is not treatable that you get rid of it is HIV. But with HIV, all of our moms that we know about that are on meds have not had a baby that's born positive for HIV. So medication does do a world of good, where the mother can transmit only about 1%. And if they've been undetectable all during their pregnancy, those babies will be negative as well. Well, I want to thank you all for attending. And if you never need anything, just please give me a call.
All right, thank you everyone for attending today. Please share this valuable information. Please notate the numbers and addresses that were put in the chat. Also, we do have one more question that came in, Yvette. It says, do you offer incentives for them to test and receive treatment?
So, good question. We do have some incentives that we give, but this is how the women that are HIV positive get more incentives, because we have Ryan White that helps us with incentives. The Tallahassee does give us rapid tests for syphilis and stuff like that, but they really don't give us incentives for women with syphilis. We do try to make it easy. We'll go pick them up because we have company cars. We can go pick them up. We can bring them to Broward Wellness. We can bring them to their OB. We try to make it easy for them, especially if they have transportation issues and things like that. But we only have really incentives for women with HIV because the money comes from a different source and it's easier. Never fair, but it's easier.
I have a quick question for Yvette. Is there any ways that that you guys have any flyer or information, educational, just for prevention, and to to bring it to families, because we are based on home visits, and we definitely work on prevention, and we would love to have some education, like information that is presented in a easy way to read for family, and to just bring it home and
We
have education.
We definitely have a POM card for syphilis that talks about it. Get tested. It's very easily. It's something that says like, get tested in the first trimester, get tested in the last trimester, so your baby doesn't come, so your baby doesn't born with syphilis. It talks a little bit about treatment, and it's just a regular POM card that the health department does. Now I have boxes of that. I can bring that to Alima too. I don't know, or to, or where can I bring that? You tell me.
We would love to have it. We are at Henderson Behavioral Health, 4700.
Well, Yvette, you can bring them to the main office, and then I'll email the provider. So when they come to pick up their diapers, they can get a stack of those.
Okay.
Too.
Thank
And
you so
I
much.
just have to double check to make sure that it's approved. If it's through
Okay.
DOH, most likely it is, but we just have to do a double check. As a matter of fact, if you actually have that digitally, so I can send it off just to say, hey, this is something that we want to share, will be
I can
great.
take a picture of it and send it to you. I don't think I have it.
Thank you. Yeah, take a picture,
So I'll send it to
double-sided.
you, and that would be great. And we have boxes and boxes of this. It's very simple. And I think that I think Monica has seen this before. Has she? I think so. But I'll take a picture of it, send it to you. All right. And then you
Take a
can let me
picture,
know.
send it. I'll get it sent off today, and so we can get a quick turnaround to see. And if it's
Okay.
approved, then you can deliver the palm cards, and I can distribute it to the providers that we have.
If I was gonna bring me one, I think I can bring it up so she can see it. It's such a, it's not a, it's no, not that, the palm cards, the palm cards. We also have these pictures, like you saw those two pictures that everybody went, ugh. We have actual pictures of syphilis and other parts of the bodies, but that's more for you know, but it's a palm card like this. Can you see it?
Mhm.
It says protect yourself, get tested for syphilis, HIV, and other sexually transmitted. But there's one that's this is for all STDs, and then in the back it has and in the front has the phone number 954. But this number is not this is another number you can get to. But this is just a general one. We have one that is strictly for syphilis. It's a longer version, but again, I'll send you a picture of it, and then you guys can decide.
Okay. And yes, Jacqueline, once we get the approval, I'm not sure if you are with Healthy Start, but once we get the approval, we will get them sent out virtually as well as have a physical in-hand palm card. All right. Is there anyone else online that has a question for Yvette today? And she also put her number earlier. Yvette, put your number in the chat one more time. I'm sorry. I know you did the wellness number, but that way, if you have any further questions or you think of something later, you'll have a way to reach out to her. This session will also get held again Wednesday at the same time. So if you want to share with colleagues or give anyone some information, I think they may benefit from this information, have them register. It did go out through email as well as on our social media sites. With the registration link is there so they can register for this lunch and learn. So I just want to thank everyone for their attendance today. We really, really appreciate it. Again, if you have any questions, feel free to reach out and we'll see you next time. Thanks for coming.
Thank
so
you.
much, Yvette. Appreciate it.
Thank you.
Thank you.
Thank you so much. Have a good day.
Thank you.
Thank you.
Have a good day, everyone.